Hi, my name is Kayla Naismith. I will not be in class this week, so I'm recording my case study. I had case study B, which is about sickle cell disease. So the case is Jason Smith is a 14-year-old African-American boy known to have sickle cell disease. He was admitted to Children's Hospital with severe pain in the hip and lower back. He had both an enlarged liver and spleen and a hematocrit of 24%. Blood chemistries revealed a mild elevation in serum bilirubin, and urine analysis indicated microscopic hematuria. He was treated with oxygen delivered by mask and IV hydromorphone, aka Dilaudid, for pain control and began to improve. So question 1, what is sickle cell disease? And be sure to explain the molecular changes that are underlying this disease process. So sickle cell disease is an inherited disorder where people have an abnormal hemoglobin molecules. This disease is recessive, so that means you do have to get it from both parents. If you only have it from one parent, you're a carrier of the disease and you can pass it on to your offspring. When patients do get it from both parents and you have sickle cell disease, their red blood cells form a crescent or a sickle cell shape instead of the normal disc shape that's in normal red blood cells. The normal disc shape allows blood cells to be more flexible. They can move through the different blood vessels more easily. But the crescent shape of these red blood cells are stiff and they tend to clump together. They're kind of sticky and they can form blockages. And red blood cells in someone with sickle cell disease don't last as long as normal red blood cells. And then even though the body initially tries to compensate, eventually this leads to anemic blood vessels as these cells die off faster than the body can replace them. The hemoglobin molecule is typically made up of 2 alpha chains and 2 beta chains, each with about 150 amino acids. So that leads to about 600 amino acids between all 4. And in sickle cell anemia, only 2 of the amino acids have been replaced or out of place compared to that whole chain. So these proteins are polymers created from sequences of amino acids chains, and there's several different levels of structure in a protein. The primary structure refers to the actual specific linear sequence of amino acids, and so in each protein is made up of a very specific sequence of amino acids. So if even one is off, it can change the entire structure of a protein. Because in the secondary structure, this is where you have I'll talk about the secondary structure in the next question. So this is usually the case in sickle cell anemia, where in the polypeptide chains, glutamate is usually the 7th amino acid in the chain in the hemoglobin B in that beta chain. But in sickle cell anemia, that glutamate is replaced by valine. So one change makes a huge difference. And this alters all of the following structures in building proteins. And so that change in interaction between the amino acids with each other and changing that protein shape is what ends up changing the shape of the red blood cell. So question 2, explain the general relationship between protein structure and function and how a mutation can give rise to protein structure. Like I mentioned earlier, proteins are made of chains of amino acids, and amino acids consist of an N-terminus, the backbone, which has an R group off it, and the C-terminus. And each section of the amino acid, particularly the interaction between R groups, indicates what bonds these take and whether or not they're going to form an alpha sheet, alpha helix or a beta sheet. So there are several different levels of structure to a protein. First is that primary structure, which is the linear sequence, the specific sequence of amino acids in a polypeptide chain. And the amino group and the carboxyl group, the N-terminus and the C-terminus, react with the N-terminus and the C-terminus in the next amino acid to start to create that polypeptide chain. Then the secondary structure is the structure that forms when the backbones of the amino acids start to interact with each other. And that's when it starts to fold, that linear sequence folds into either an alpha helix or a beta sheet. And the bond is usually between the carbonyl group of one amino acid and the amino H of another. So next you have the third level, the tertiary structure, which helps create that overall 3D shape of your proteins when the R groups start to interact with each other, and it really starts to fold in on each other and create that 3D shape. And the different R groups react with each other and create different types of bonds, which starts to indicate the type of function this protein is going to have. And then the quaternary structure is when different tertiary structures form together. So you'll have two different polypeptide chains interacting with each other, interacting with the R groups of another. So even the slightest change in the sequence of amino acids when this is proteins being created can change the whole sequence of events. The primary structure changes the secondary structure, changes the tertiary structure, changes the quaternary structure, which ultimately changes the function of this whole protein. The third question, what abnormal physiologic process causes the painful episodes associated with SCD? So because these sickle cells aren't flexible and tend to stick to vessel walls, they often form blockages which slows or stops the flow of blood to different areas of the body. So what was easiest for me to compare it to is to compare a sickle cell crisis to a myocardial infarction, which is also another form of blockage. So when someone's going into a sickle cell crisis, they have this blockage. Oxygen cannot reach the distal tissues, and that's the source of pain. Just like someone has pain during a heart attack, they're going to have pain during this because the blood flow has been impaired. And this pain often occurs without warning, and these patients really need to be admitted to the hospital. And some of the treatment is similar to what you would do for someone who is having a heart attack. So you give them oxygen, you give them pain medication, and then you have to, figure out a way to alleviate this blockage. And these sticking of cells and continuously forming these blockages multiple times and having multiple crises over a lifetime can lead to long-term damage to someone's organs. So question 4, explain the therapeutic effect of supplemental oxygen in sickle cell patients in a painful crisis. So like I said earlier, the therapeutic effect is similar to patients going through a myocardial infarction. The idea is to kind of make more oxygen available to the patients so that you can get oxygen beyond that blockage, hopefully if it's not completely blocked, or supply enough oxygen to the surrounding tissue that isn't blocked. However, when I did all my research for this case study, a lot of research shows unless the patient is hypoxic, there isn't necessarily a therapeutic effect to supplying oxygen. So the current recommendation is to only give supplemental oxygen if they are, in fact, hypoxic. Question 5, what is the significance of an enlarged liver and spleen, the hematocrit and the elevated serum bilirubin, and the microscopic hematuria? So the hematocrit is low because sickle cells don't last as long as normal well-shaped red blood cells. So the body breaks them down and reprocesses them, and the body tries to compensate, but since these cells are breaking down so quickly, it can't keep up, and that's when the anemia starts to show, and that's why you have that low hematocrit. And one of the areas where these cells are processed is in the spleen. So the spleen is involved in the creation and destruction of red blood cells, and with sickle cells, they can normally pass through the spleen without issue, but in sickle cell anemia, these red blood cells are getting processed faster because they don't last as long, and so that means you're having a greater flow and a greater breakdown of red blood cells in the spleen, and because of the formation of these sickle cells that have that crescent shape that tend to form blockages that don't move as easily through these blood vessels, it all kind of creates a blockage in the spleen, and the spleen becomes overworked and hypertrophied. And actually, a lot of people with sickle cell disease don't have normal functioning spleens after multiple crises because the spleen becomes scarred and doesn't work as well. And when blood cells are being broken down, they're also processed by the liver. So again, liver's being overworked, these red blood cells, and you're having this increased destruction of red blood cells. And whenever the liver's overworked, it starts to become enlarged. And then this overload of red blood cell hemolysis eventually leads to a buildup of bilirubin, because that's something that's released from these cells when they're being broken down. And then the microscopic hematuria is actually one of the most common complications of sickle cell disease, because when you have multiple infarcts from the sickle cells accumulating, that damages these kidneys. So all of these symptoms do indicate that he is having a pretty significant sickle cell crisis. And then 6 is sometimes patients with sickle cell disease are treated with hydroxyurea. How might this drug help Jason? So hydroxyurea is a medication that's been shown to reduce the number of pain crises you have, the number of hospitalizations, and improve the length and quality of life in these patients. It was originally a chemotherapy agent, but several studies showed that it helps increase the production of F-fetal in red blood cells, which helps keep these red blood cells from forming that sickle cell shape, helps them retain their normal shape, which keeps these red blood cells soft, flexible, and they can move through the body easily, and keeps them from aggregating, forming these blockages, which is the source of pain and organ damage in sickle cell patients. This could help Jason by decreasing the number of active sickle cells he has in his bloodstream. It would decrease the aggregation of the sickle cells in his body, so he wouldn't have the organ damage beyond what he's already had. It would help decrease the amount of scarring and fibrosis he would have on his spleen and his liver. And then it decreases some of the workload that the spleen and the liver have had to go through. So it would help with his pain and a lot of his symptoms. So that's what I was able to find on sickle cell disease. Hopefully I did not miss anything. If I did, I'm sorry, and I'm sure you guys will talk about it during class. I hope you have a great week.